7 diabetes emergency warning signs. You must know. Diabetes, a common ailment that affects millions of people worldwide, frequently exhibits mild symptoms that require attention. Certain emergency signals, on the other hand, might signify a potentially life-threatening scenario. Here are 7 diabetic emergency indicators that everyone, whether diagnosed or not, should be aware of. Number 1. Nausea and vomiting. It is common symptoms of various ailments take on a particular significance in the context of diabetes. Persistent nausea and vomiting in persons with this illness can be precursors to a severe metabolic crisis known as diabetic ketoacidosis, or DKA. When the body can't efficiently utilize glucose due to insufficient insulin, it turns to fat for energy. This fat breakdown generates ketones, acidic byproducts that, in excess, can make the blood overly acidic. As ketone levels grow, they might begin to irritate the stomach lining, resulting in nausea and even vomiting. But it's not just about an upset stomach. The nausea and vomiting are the body's attempts to rid itself of these excess acids. In diabetics, that nausea and vomiting aren't just symptoms to be alleviated. Alarm bells are clanging. They suggest a serious problem with the body's metabolic regulation, which demands rapid care. Number 2. Fruity breath. In the context of diabetes, fruity breath is a particular sweet or fruity odor that emanates from an individual's breath. This is not a normal or healthy sign. The phenomenon occurs due to the presence of high levels of ketones in the blood. When the body cannot access enough glucose for energy due to insufficient insulin, it starts burning fat for fuel. This fat metabolism produces ketones as byproducts. While small amounts of ketones can be expelled from the body through urine, when their production outpaces the body's ability to get rid of them, they accumulate in the blood. This accumulation leads to a condition known as ketosis. As the concentration of ketones increases, the body attempts to expel them by expiration, resulting in the evident fruity breath. For someone with diabetes, especially type 1 diabetes, the presence of a fruity breath is a red flag for diabetic ketoacidosis, DKA. DKA is a dangerous and possibly fatal illness, characterized by an abnormally high rise in blood sugar levels and a large accumulation of ketones in the blood. If not treated promptly, DKA can lead to dehydration, brain swelling, coma, or even death. The underlying cause for the development of DKA can be varied. It might be caused by a lack of insulin, an illness or infection, or other circumstances that induce an imbalance in one's metabolic system. Number 3. Rapid breathing or shortness of breath. Rapid breathing or shortness of breath in a person with diabetes isn't just an incidental symptom, it's an ominous indicator of an underlying metabolic disturbance. Breathing is inextricably tied to our body's requirement to maintain pH balance and control carbon dioxide, CO2. When the body starts to experience a significant buildup of acids, it naturally attempts to exhale more CO2 to compensate and restore the pH balance. In the context of diabetes, this abnormal respiratory pattern often signifies the onset of diabetic ketoacidosis, DKA. When the body is unable to use glucose for energy owing to a shortage of insulin, it resorts to fat breakdown. This process results in the release of ketones, acidic compounds. As ketone levels rise, the blood becomes more acidic, triggering the respiratory system to expel CO2 more rapidly, manifesting as fast or labored breathing. When the body is unable to use glucose for energy owing to a shortage of insulin, it resorts to fat breakdown. As DKA progresses, it can lead to other severe complications, even coma or death if left untreated. Number 4. Weakness or fatigue. When someone with diabetes experiences a profound sense of weakness or fatigue, it's not just the usual exhaustion that comes with a hard day. Diabetes revolves around the body's ability to use glucose, the primary energy currency for cells. If glucose isn't effectively utilized, energy production can be compromised. When insulin is not present or is not functioning properly in diabetes, glucose cannot enter cells for energy synthesis, resulting in a condition of energy deprivation. This situation is like having fuel around a car, but not in its tank. The body, although surrounded by glucose in the blood, can't convert it to usable energy, causing feelings of profound fatigue. On the other end of the spectrum, if blood sugar levels plummet too low, hypoglycemia, the body is again deprived of its necessary energy, manifesting in weakness. In the world of diabetes care, this isn't just about feeling tired. It's a symptom pointing towards potentially dangerous glucose imbalances, whether due to hyperglycemia or hypoglycemia. Number 5. Confusion or altered mental state. Confusion or altered mental state in a diabetic is more than a passing issue. It is an urgent red signal indicating probable metabolic instability. Our brain is a glucose-dependent organ, requiring a steady supply for optimal function. When blood sugar levels swing to extremes, either too high hyperglycemia or too low hypoglycemia, it can directly impact brain function, resulting in symptoms such as disorientation, dizziness, or altered awareness. In the context of diabetes, prolonged hyperglycemia can result in diabetic ketoacidosis, DKA. High levels of ketones and glucose can cause the brain to function abnormally, leading to cognitive changes. Severe hypoglycemia, on the other hand, might deplete the brain of its principal energy supply, resulting in comparable cognitive impairments. These changes in mental state are not mere side effects, they're direct manifestations of the brain's response to metabolic chaos. Number 6. Blurry vision. Blurry vision in someone with diabetes is not just a simple eye problem. The retina and lens, in particular, rely on a precise balance of fluid and nutrients to operate properly. Elevated blood sugar levels in the context of diabetes can cause alterations in this balance. When blood glucose levels soar, it causes the lens in the eye to swell due to osmotic imbalances, altering its shape and ability to focus, leading to blurriness. This isn't merely a temporary inconvenience, it's the eye's response to systemic hyperglycemia. Conversely, if someone with diabetes suddenly improves their blood sugar control, the eye might again undergo changes, leading to temporary vision disturbances beyond the immediate impact on the lens. High blood sugar levels over an extended period of time can also damage the blood vessels in the retina, a disease known as diabetic retinopathy. Over time, this can lead to significant vision impairments or even blindness. In essence, blurry vision is a visual alarm set off by the body, indicating potential blood sugar irregularities. For those with diabetes or those around them, number 7, abdominal pain. In the landscape of diabetes, symptoms abdominal pain isn't just an isolated discomfort, it's a significant alert of potential metabolic turmoil. While abdominal pain can arise from various sources, in the diabetic context, it often suggests a severe condition caused by diabetic ketoacidosis, DKA. DKA develops when the body lacks enough insulin, which prevents it from using glucose as an energy source. Ketones are produced as a result of the body starting to use fat as an alternative energy source. These acidic compounds, when accumulated in the bloodstream, can cause the blood's pH to drop, leading to a state of acidosis. The buildup of these ketones can irritate the lining of the stomach, causing discomfort and pain. This isn't a mere stomach ache, it's an indicator of the body's internal environment becoming dangerously acidic. Abdominal discomfort, especially when accompanied by additional symptoms such as nausea, vomiting, or fruity breath, is a red flag for someone with diabetes. Recognizing the emergency signs of diabetes is not just about knowledge, it's about empowerment. These symptoms act as the body's distress signals, highlighting when something is critically amiss. This information provides patients, caregivers, and loved ones with the skills they need to act quickly, ensuring that diabetes stays a manageable illness rather than a looming emergency. You might also want to watch this video for other critical diabetes signs you should know, and please subscribe to this channel if you found this video helpful. Thank you for watching.